Hello, and a very warm welcome to this foresight discussion on what's next for our planet and our health. My name is Isabel Hilton. I'm a journalist and I'm the founder of ChinaDialogue.net, which focuses on all things climate and environment. We're all still living through this traumatic global event. It's taken nearly 4 million lives by now. And if here in the UK, we hope that some kind of end is in sight, we should remember that in many other countries, it continues to rage. So before we get into our discussion, I want to invite you to a quick poll. It's kind of a temperature check of the mood of our audience, if you like. It's coming up on screen now, and you will see the question there. The question is, are you more or less hopeful about the future of the planet following the outbreak of COVID-19 and all that's followed? So please answer the poll now. If you respond now, we will take a look at the results shortly. So as I said, COVID-19 does continue to rage in many countries. It was all caused, of course, by a shape-shifting organism invisible to the naked eye. And it's a reminder, if we needed it, that nature comes in many forms and should never be underestimated. So many aspects of all our lives are changed forever. And today we'll be talking about that. And importantly, what might still need to change, or what might we still need to change? I think until the pandemic, it's fair to say that global health was one of those issues that was always there, but not usually top of the national or the multilateral agendas. And now, though, it has this prominence that I think would have been hard to imagine before the pandemic. We had hoped that 2020 would be the defining year for international climate and environmental action. Instead, the COVID-19 emergency has pushed climate change and biodiversity off the calendar for a complete year. And now we're halfway through 2021. We can see that in this interconnected, globalized world, each of us depends both on the health of our fellow humans and the health of our planet. Still, we continue to disrupt the natural life support systems, the air, the water, the biodiversity, and the climate. And through those systems, through the systems that we have built, our human relationship with nature is still impacting global health, and those least responsible tend to be hit the hardest. But if the dangers are clear, there are also opportunities. These crises do create new ways of thinking and new opportunities to apply that thinking. And there's innovative science now that tells us more about planetary health. And we're learning perhaps to respect the sustainable practices of other cultures. And perhaps we're also learning how to protect our health by protecting nature. And that's really what we're going to be exploring today. And I'm delighted to be joined by a stellar panel, Mariela Neudecker, an artist and long-standing collaborator in arts and science with Invisible Dust. She's Professor of Fine Art at the Bath School of Art, and she's on the Arts at CERN's guest program, the European Commission's GRC SciArt Advisory Panel, and the Steering Committee of the Centre of Gravity UK. We're also very pleased to welcome Sir David King, former UK Chief Scientific Advisor, former Climate Envoy, and the founder of the Cambridge Centre for Climate Repair and the new Climate Crisis Advisory Group. And Penny Murage, Co-Deputy Director of the Centre on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. So before we plunge into our discussion, are we optimistic or pessimistic? Let's take a quick look at the poll results, if we could have them on screen. Slight tendency to less, but a substantial number about the same, which is interesting. Good. Well, perhaps we can turn that pessimism around with our discussion. And let's also perhaps remind you that we very much welcome your questions. Please put them into the Q&A box at the bottom of the screen, not the chat box, and we'll get to as many as we can in the Q&A session. But first, let's hear from our panelists. So I'm going to put essentially the same question to each of our panelists to start the discussion, starting, if I may, with Sir Dave King. The question is, we should have learned by now that our thinking on health and nature has got us into serious trouble. So Dave King, how could we think about health and nature differently? Dave, are we?
Hello?
Yes, we can hear you now. Welcome. Did you hear the question? Would you like me to repeat it?
I did not hear the question.
So the question, Dave, which is going to you and to your fellow panelists, is that given that we now understand that our previous thinking on health and nature has got us into some trouble, how could we now think about health and nature differently?
Gosh, that's a very, very broad-based question. So let me just say the following. We depend critically on our ecosystems around us. We evolved into our ecosystems, and what we're now doing is damaging them, and of course it damages our health. All we have to look today is at what's happening in Canada with their extreme heat and the number of people dying from heat stress. When temperatures are over 30, when wet bulb temperatures, that is humidity plus temperature over 36 degrees, people will die 3 or 4 days into a heat of that kind if they have no access to air conditioning. So what we are learning is that we have been damaging our ecosystems, and the damage to our personal health is so serious that we've got to expect during heat waves very large number of fatalities.
And if you had to change one big thing about how we perceive this relationship between health and between human and planetary health, what would it be?
I think there's a relatively simple thing to say, but at the same time, it requires such a cultural transition that it will take quite a while to come about. We need to understand that we must treat managing the health of our ecosystems alongside the health of humanity. We must treat the well-being of both simultaneously. It's what's been introduced in China, and I've spoken at the meeting that introduced this into their constitution fairly recently. They're calling it eco-civilization. And the concept of eco-civilization is creating this understanding in our culture that the two have equal importance. It was interesting that it came from China because their culture, both with Taoism and Buddhism, really teaches us that we depend on nature. We all know that we depend, for example, on bees, and bees don't depend on us, right? So we need to understand that if we attach zero value to what we're doing to nature, we are damaging ourselves.
Thank you. Penny, your work, I mentioned this really quite pioneering scientific approach, and perhaps a change in the way science thinks about the relationship between health and nature, and developing planetary health as a new field. So how do you think we need to change our thinking about health and nature at this point?
Thanks, Isabel. It's a really good question. It's a question that we've been grappling a lot with in healthcare and also in medicine. But I think if we take a step back, the starting point really is a realization or an understanding that the present medical and public health model, as we know, it's been very successful at improving population health. So we think of advances in vaccination and in sanitation, and also in the use of the medication that we use. A lot of them have natural origins or compounds that are inspired by nature. So all that has resulted to huge benefits to human health. But these public health models are very human-centric. They have a lot of bias to human health, and therefore they're insufficient in dealing with some of the crises that Sir David talked about. And this is they're very insufficient, particularly in tackling the issues that we face in this new epoch that we call the epoch of the Anthropocene. And I think what your question is alluding to is that we need new ways of thinking and radical ways of approaching and delivering healthcare. So this introduces the concept of planetary health. And it's really based on the understanding that our health, our civilization, and our survival depends on flourishing natural systems and the sustainable management of those systems. Okay, so what's happened is that population health and human health over the decades has improved. So we live longer, we are more affluent, and this is globally, but also our population has just grown. But this has been at the expense of natural systems. So a lot of them have been depleted, and there's an unprecedented loss of natural systems that support life. So it's this imbalance that we grapple with in healthcare. In terms of some of the radical approaches, so I'm an educator, I work at university. So I think some of those approaches will come in how we teach and how we nurture the future generations. So one of the things that springs to mind is how do we incorporate and integrate ecological knowledge into teaching in public health, but also teaching in medicine? And how do we sustain that for future generations? So that's one of the things I'd like to see is a sort of a radical overhaul of what we teach. And the London School of Hygiene and Tropical Medicine, so my institution has been a pioneer in this field. So the Center for Climate Change and Planetary Health has been developing a postgraduate level degree in planetary health and climate change to try and grapple and tackle some of those changes. And actually, before I conclude, I want to pay credit to our students because they've been really instrumental in pushing us by telling us or by articulating very well what are the gaps in the knowledge and what do we need to be teaching.
Thank you.
I'll stop there.
Thank you. There is definitely some ideas I want to come back to, but first I want to ask Marilla to address the same question. Marilla, your work crosses all kinds of boundaries, boundaries of within art and boundaries between art and science. And I guess that also, you know, is one way of looking at things differently. But how do you think we should think about health and nature differently from where from how we think about it now or did before the pandemic? Maria, I think you're muted.
I'm sorry, I was muted. I'll start again. Sorry. Yeah, no, it's really crucial where you start thinking about this, and it's going back a long way probably. And there have been already really good points made, but yeah, it's obviously a lot to do with communication and imagination as well, I think. And this is where art comes into it, and science as well, where somehow the promotion is kind of probably more to do with the science, but in a way the perception and the understanding is a lot to do with how art is kind of influencing our understanding of the world and how we live and everything around us. And the pandemic is probably our starting point with a lot of this conversation, I would have thought. And there is a lot of sort of the saying and proclaiming that we still have time to do things, but nothing really happens. And I think the pandemic has really highlighted something that is so global, and it's kind of made a very big difference in understanding humanity as a more global issue, whatever you want to call it. And I think this is where art and science has a very important sort of role to play in terms of understanding and changing our attitudes and at least changing the attitudes to then hopefully act. And this is the part of the problem, because there's a lot of activity that has happened and might happen, but will it happen in time is the big question. And I think there is a lot of urgency that gets talked about, but is it really understood? So in a way, I think our role is to kind of help communicating a lot of those questions, if that makes sense.
It makes perfect sense. I do have one follow-up question, though. I think it's quite easy to understand how science might influence art, and scientific ideas could find a different expression through art. But I wonder if art can influence science. We tend to think in these circumstances that science is our savior. Perhaps David King might have something to say on this too. But also science can be quite siloed, and science can produce or can have the effect of producing some of the crises we then have to address. It's not necessarily syncretic thinking in the way that art can be. Can you see an influence of art on scientific thinking at all, or is it all one way?
I don't think it's just. Oh, sorry. Are you talking to David?
I am talking to you. Yes, yes. Manila, yes.
We can both answer. I'll just give you a brief answer because I think it's beginning to happen, definitely. I think there are more and more scientists who are intrigued and curious about art and involved with artists. This has been going on for a long time, but I think recently it's become more, has a sort of, hopefully, a momentum starting to happen, and also this sort of need and the urge of artists to try to influence some of the policies and some of the sort of legal circumstances. I think it's beginning to happen, yeah. That's probably the one thing where I'm a bit optimistic.
I'm pleased to hear it. David, is art beginning to influence science? You're a scientist.
Art has been influencing science. Let me take you back to the 15th century, when one of the greatest figures in both arts and science was Leonardo da Vinci. And I am forever a great fan of his observations, because what he did in those wonderful drawings and ideas, how do we fly? We should imitate birds in flight. And he did beautiful drawings of birds in flight and then tried to imitate it through machinery. So I wouldn't say that the arts and the sciences have diverged until quite recently. Let's not forget, science comes from the Latin word scientia, simply meaning knowledge. And I'm personally very close to the arts and the sciences. For example, I'm the chairman of the judge of the world's biggest art photography prize, the Prix Pictet, and it gives me an awful lot of not only pleasure, but it's a very revealing part of the whole process. So I think what is important is to understand, where did that division between arts and science come from? Here in Britain, our A-level system really damaged products, in the sense that many kids aged quite young, 16, 17, are making decisions even earlier whether to go into the arts or the sciences. And so the education becomes split. I would love to go back to the old matriculation system, which they still have in Scotland. So I think the divide is problematic. We both tend to speak different languages, and we need to really break that division by having more opportunities to come together.
So that's the famous two cultures problem that Britain has suffered from, or England, as you rightly point out, has suffered from for far too long.
C.P. Snow, back to C.P. Snow, absolutely. But I do also want to say, it's the cultural problem goes back to our free market system, and the free market system that we have imposed on us. And excuse me, I'm on an iPhone because I've not got my laptop at the moment, and so I'm just having a little bit of difficulty. Can you still hear me?
We can still hear you, and you're now back in vision.
Yes.
I do want to pick up on that point about the market economy, because but perhaps we could come back to it.
Right.
And right now, Penny, you, in your opening remarks, you talked about the success of the approach to global health in delivering longevity, better health, and indeed affluence. All of those would be conventionally regarded as good things. This has, however, led to a much bigger population than we have ever had.
Yeah.
It's a tricky conversation, however. You know, if these are indeed, these goods, these public goods are the things that are in fact damaging planetary health, that's a very difficult conversation to have, isn't it? I mean, we can't begin to think of those things as bad things.
Yes, and lots of ethical implications as well when you think about it. But I think sort of the basis of the problem is this idea that humans are the dominant species. So we put ourselves on a hierarchy and we say we are at the top of that hierarchy and every other species is at the bottom. And I think one of the radical approaches will be to rethink that hierarchy where all species have the same on the same level. But it's a very difficult thing to imagine. But I think ecologists, for instance, have been saying that for a long time. Conservation scientists have been saying that for a long time, and I think healthcare is only starting to catch up. So
these are very deeply culturally embedded attitudes. However, I remember being in a discussion, a symposium on faith and climate change, in which the subject under discussion was that God gave Adam dominion over nature in Genesis, and that was, of course, highly problematic. And in fact, in Marxism, David, you talked about value. Mao Zedong, and now eco-civilization, but Mao Zedong believed in conquering nature, just as the kind of Soviet and capitalist idea also of conquering nature.
yes.
How do we start to revalue nature when we are pretty much hardwired to think of ourselves as the dominant species, as Penny says?
Is that a question for me? I can elaborate a little bit. Yeah, I think we need to start seeing ourselves as stewards of nature rather than just exploiters and users of nature. There's a difference. So, and this is why we have to emphasize this sustainable management. Along that, I think we also need to start, and there's been a lot of momentum now in this idea of nature-based solutions. So where we look for solutions that do multiple things, so deliver multiple benefits in terms of enhancing nature, but also delivering sustainable development goals. And I can give a few examples of this, but one area that I'm closely working on in terms of my research is things like agroforestry. So where we intentionally integrate trees and forests in our croplands. So we're doing two things here. We are sustaining forests and that natural environment, but at the same time, we are producing food. And those two things go, if well implemented, have multiple benefits, environmental benefits, but also economic and social benefits.
Yeah.
David, if you're with us, I'd like to come back to that.
I am with you, yes.
Very good. I'd like to come back to that question that you touched on, which about the question of market economies, and I want to approach it from the question of what we value. We've had a sort of extractive approach, I think, to nature. We would probably all agree, and without valuing what either the ecosystem services that nature provides, or indeed sufficiently valuing perhaps the health benefits of a better relationship with nature. Is it about resetting the idea of value and the idea of benefit in the kind of our economic approach, in our approach in science, in our approach to health? Is there a rebalancing there that you can see?
Absolutely. So I apologize. Absolutely. I think the free market system, and by free market, I mean without any proper regulatory systems, has delivered massive advantages to human beings around the world. We've seen, even this century, since 2000, the number of people who could be described as middle class in the world has expanded from around 1 billion, 1.5 billion to well over 3 billion. So what we're seeing is rapid improvement in human well-being around the world. The big risk is coming, and of course I'm going to say this, from climate change. We are driving ourselves into a situation where humanity cannot survive in anything like its present form unless this message is got across, that this free market system is actually not fit for purpose in the 21st century. And we need to examine exactly what that statement means. It means that if we carry on not giving real value to ecosystems, then frankly, we're driving humanity out of the place on this planet. The planet will continue, other parts of the living systems will continue, but we will not continue in our present form. So this is an existential threat to us. And I think I don't want to run into a despairing situation where I say it's very difficult to see this transition happening. I fear that this decision is going to happen through multiple disasters happening around the world, and then people waking up to it a bit late, just as we've woken up to COVID-19 a bit late. So I think the problem is enormous because it is a cultural problem. If we go for many centuries giving no value to the ecosystems, if we simply dump stuff into the atmosphere, dump stuff into the ocean, if we create chaos around ourselves in that way, we have done it because we were only focused on the value of commodities. And so we have driven ourselves into a situation where super consumerism seems to be the objective of everything. I go into countries even like, as you were saying, I can go into China, go into Shanghai, go into Beijing, and I see super consumerism all around me there. And of course, that is disappointing. I very much welcome the introduction of the idea of eco-civilization there in China, but they also are up against it because their economy has delivered so much for their human population. But there's the challenge and there's the rub. We go against GDP growth if we say we must see less massive consumerism, because GDP growth is driven by consumerism.
But I think it's increasingly recognized as a rather inadequate measure of well-being, since it leaves out so many other
Exactly. Yeah.
David there said he fears that it will take a disaster to make people understand the threat, the true scale of the threat of climate change. But we are already in a disaster. We're in a planetary health disaster, in a pandemic. Just looking at cultural change, I mean, one effect of the pandemic, certainly in the first lockdown in Britain, was that people suddenly noticed that the noise had stopped and that you could hear birds and that animals were entering the cities. And there was a moment when people seemed to wake up to a natural world that at least urban dwellers had rather long forgotten. You understand about cultural change. Do you think that this perception, this realization is something that can last and that might change our idea of what is a healthy environment and a healthy planet?
Yes, I think it seems to last, but at the same time you could probably argue exactly the other way. For some people it does, for some people it does not last, that you have more respect for nature, that you spend more time enjoying the absence of planes or travel or all those things that the pandemic has brought us. There's I think it's a mixed bag. I said yes, and I actually mean yes and no, because there's a bit of both. I think people really appreciate the fact that they can avoid travel and maybe work from home more, maybe travel less, have meetings online. Having said all that, I think we're so tuned in now with Zoom meetings and technology and all those things. It's very easy to get kind of pulled into a whole different culture of interconnectedness and all that, but at the same time you sort of lose contact with people, and it's a sort of double-edged thing. You lose contact with people as people in reality, but at the same time you might make a lot more contact with people that you wouldn't normally have contact with. I certainly enjoyed having contact with a lot of international discussions and groups and people because of technology. But then I suppose my work deals a lot with the ocean as well, and it's important to me to kind of not forget how important the ocean is, and especially this year, in the year of the ocean, there's a lot of talk about the ocean and a lot of a lot of discussions and a lot of exhibitions to do with the sort of questions around the health of the ocean and how much we depend on it. And I think this is sort of coming to a point that needs to be made again as well, how much humans are part of nature, even though they often look at it as a separate thing, and we're discussing nature as humans. But I think one thing that pandemic has probably brought a little bit closer to some people is that we are part of nature, and we certainly need to learn more respect and learn to make decisions in a way that are more sustainable, or it has shown that we don't need to travel so much and that we don't need to go unnecessarily to meetings abroad and all this sort of thing, because we're used to this. At the same time, phones, computers, all the technology relies on a lot of metals and a lot of materials that are having to be sourced and have to be resourced all the time and are not necessarily sustainable. So there is all sorts of kind of little bits of connections and issues there, I think. And
indeed, and in this year of ocean awareness, we should also perhaps remember that some of those metals are now being sought in the deepest parts of the ocean, in ecosystems that we barely understand. So we, in practice, don't seem to be learning these lessons very, very effectively.
Well, I often wonder what this offsetting means. This is my big question. How do you offset the damage? Where can you possibly offset that kind of damage? Do you know what I mean?
Yeah, indeed. Penny, you talked about us beginning to, that we should begin to recognize that we are one among many species, and that we shouldn't think ourselves as the dominant species at all. And we have talked about how deeply embedded that is in culture. Now, there obviously are other cultures and other approaches. Gaia is an example of that different idea, but they tend to be seen as rather sort of exotic, interesting, but not applicable to us. Do you think the pandemic has changed that? Has it broken down that barrier at all?
So is that the barrier between how we see nature?
The barrier between, I guess, which prevents us accepting the idea that nature is, that we are part of nature, yes, and that we don't dominate, and that we're not the most important species.
Yeah, really interesting question. I think what the pandemic has done is it has led us to re-examine our position in nature and some of the consequences of the destruction of nature and how those affect us. So, for example, COVID is a disease that may have zoonotic origins, and a lot of that comes from the destruction of forests and human interacting more closely with wildlife, for instance. But for those of us who live in urban areas, I think it's the idea of what we've really appreciated, I guess, is less traffic, less air pollution. Consequently, better air quality means better health. And I think for those of us who are shielding, unfortunately had to shield, it's the idea that a stroll in the park can have therapeutic benefits. And what has been a really good outcome from that is that now the NHS England is investing a little bit more in trying to understand the role of green prescription in the management of chronic diseases. So I think that is one opportunity of COVID-19, I guess, if you can call it that. But maybe there are other opportunities. And one of the other bigger opportunity is really understanding where we can start focusing on in terms of reducing carbon emissions. Because we've managed to do that in 2020. I was reading some studies on this, and some of the documented evidence shows around 7% drop in carbon emissions, higher in some countries and higher in some sectors. But how do we keep up that momentum? is a really good question, I think.
I think the whole question of lessons that may or may not emerge from the pandemic is a really interesting one. Could I just, before we continue, encourage our audience to put their own questions into the Q&A function, and we will definitely try to answer them in the Q&A, in the larger Q&A session. Right now, though, David, this question of lessons, you, like all of us, have lived through this pandemic. Do you see any read across between the impacts of COVID-19 and the discussion on climate change? Has it helped? Has it changed the nature of the conversation? We know that it's made it, a secondary issue, at least last year when we were in full emergency. But as we begin to emerge from the pandemic, what impacts do you see on the kind of work that you do?
So let me give you a personal answer to that. Back in 2006, I put a report into government when I was Chief Scientific Advisor to Tony Blair on infectious diseases. And I had 340 experts working with me on that program for about 2.5 years. And that included people from the WHO, it included people from Africa and in particular China. And the conclusion of that report, and it's still on the Government Office for Science's website, the conclusion from that report was that a pandemic exactly of the kind that has happened, we predicted it would occur due to the mutation of a virus from a wild animal crossing over to become habituated to a human being, and that this would occur somewhere in the world where people are in close contact with wild animals. This is particularly happening where people don't have refrigerators at home and they buy wild animals at the marketplace to eat them, but they don't kill them until they need to eat. So there's a close contact there. And the prediction was made on a statistical basis. Before 2030, we said a pandemic of this kind would occur. And we also pointed out that within 3 months of this occurring anywhere in the world, we tried in modeling to insert it into a small village in Central Africa. Within 3 months, it would be everywhere in the world because of air travel. The efficiency of air travel is wonderful for a virus to get around the planet. And so what we actually advised was that we should see that there is a protection of borders at the point of knowledge of this pandemic arising somewhere. And we should also separate those with the disease and those who've been in contact with them from the rest of the population. I have to say, regretfully, that in 2010, all of the preparations that were begun in Britain were effectively undone because of the austerity measures introduced in the National Health Service and GP practices. What the focus became was on short-term measures and not on some sort of long-term risk as we were predicting. And so all of the requirements in our hospitals were actually removed. The hospitals were required to have all of the ventilators that would be needed. They were required to have the equipment for staff to protect them from a virus that was highly infectious. And when this happened in Britain, we didn't have a response that was following what we had previously laboriously set out. The WHO quickly put out very good advice. 23rd of January, the Chinese scientific community published an excellent paper in The Lancet. And if we had followed and understood the consequences of this virus, we would have done all of those measures and we would have kept the virus level down. But that should have happened in every country of the world. It happened in South Korea, it happened in Australia, it happened in New Zealand, and their infectivity rate has been very low.
Yeah.
But we ourselves did not follow our own advice.
There is the sense that perhaps the experience of SARS and Ebola in those countries made the response more alert and that the authorities were perhaps more sensitive to the dangers. I just wanted to go back to something you said about proximity of people and nature, which is often cited in these zoonotic diseases. But again, I would say, well, what about bubonic plague? I mean, that was, pre-climate change, populations were much smaller, but also a zoonotic disease. So isn't this something that we just must expect to happen regardless of our proximity to nature or indeed of climate change?
Well, you're right, but at the same time, our hygienic conditions are such where the rat population is quite high, but not in proximity to human habituation. So I do believe that the reason why we don't see those kind of plagues that often is precisely because we live in much more hygienic conditions. But the whole point,
have we elevated the risk now? Are we at elevated risk from zoonotic diseases? Is that the lesson we should draw from the last couple of decades?
We are at risk of zoonotic diseases. I don't know how elevated it is. It's always a low probability that the mutation in the virus occurs, but nevertheless, there is a very significant risk. But the whole point I really wanted to come to was we did not follow the scientific advice. And that's the danger of climate change. The climate scientists, I go back to Margaret Thatcher, 1989, making a big speech about climate change. 1988, the Senate of America and the Congress heard a wonderful speech from a climate scientist in NASA, just spelling out what was going to happen in climate change. Actually, it's all happening today, but the governments of the world have not followed that advice. And there's many reasons for this, and most of them are driven by the anti-climate science group, who are those people working in industries who felt threatened by the science of climate change, by which, of course, I mean the oil, gas, and coal industries in particular. So what we have not learned is the lesson that was given to us back in 1988, 89, and what we now need to learn from COVID-19 is please listen to the message from the scientists, and we could avoid these major challenges to living well for human beings on this earth.
Thank you. I think maybe there is another parallel between COVID and climate change. Penny, this is very much your area. There's been a notable lack of solidarity, if you like, between the wealthier countries and the poorer countries. For example, on vaccination and on support for dealing with COVID. And it's a long-running complaint within the climate discussion also that there is a lack of assistance from the countries that have grown wealthy, exploiting carbon, and those poorer countries that are suffering the impacts without having contributed to it. Do you see those parallels? And do you think that perhaps because of COVID, there might be a greater understanding of the interconnectedness and the fact that nobody's safe unless everybody's safe, which is perhaps also true of climate and COVID? Do you think we've advanced at all in how we see that as a result of the pandemic?
Yeah, I think the concept or the idea of equity is a cross-cutting one across both climate change and also our approach to COVID-19. I think there are many equity implications. For instance, you've alluded to of the transboundary nature of climate change. So countries that are suffering or feeling the most impact in the global south tend to have had very little contribution in terms of producing, generating greenhouse gas emissions in general. And that's mostly because of the sort of industries that we find in those countries. And yet the effect, the acceleration in temperature rises, floods, etc., are mostly felt in those countries. So there are huge equity implications in that. I think along the lines also there's this idea of mitigating carbon, so capturing and sequestering carbon from the atmosphere there's a little bit of a reliance on forests and grasslands and wetlands, and a lot of those natural habitats are found in those countries. And I think there's a little bit of a reluctance of why should we be the solutions, or why should those countries be solutions to a problem that they didn't necessarily cause. So, I think linking that to the equity implication on COVID, in particular COVID vaccination programs, I think, you know, a lot of those countries in the global south have been left behind, possibly maybe as a result of what happened in India. So India was meant to be supplying those vaccines, but then they had their own crisis to deal with. So yeah, huge, I don't necessarily have the answers, but just to say, yes, you know, it's good to keep in mind those equity implications, and to have debates and discussions about that, because these are ongoing issues, and we've been talking about equity for generations, really, and we haven't quite come near to addressing those issues.
Thank you. I must encourage you again, we're coming, time is marching on. If you have a question for our panelists, please put it into the Q&A. Marilla, there's a question for you specifically from Julia Davis, who talks about the idea of urgency, of time, of action that you raised in the beginning, and she wonders if you have any work under development now that addresses this specific point.
That's an interesting point, because that's probably one of the sort of difficulties that I find as an artist, and I don't speak for all the artists ever, but I think the answer is probably no. I don't think the work is necessarily that specifically about a urgent one issue or something. I think it's more general, about an understanding and a recalibrating or redefining of what we know and how we know it and how we can deal with it. But it's slightly more abstract than that. I don't know. In the question, it seems to be quite specific. I mean, obviously there is a lot of work where you question what you're seeing, and you might have a sort of, you might have an experience that you're not completely, can't quite put anywhere because it's unfamiliar, or, you know, that sort of sense of reassessing, that is important for what happens in the real world, if you like. I don't think I claim a kind of position where I would teach people what to do, ever. That's not my role. I don't think that is what I do. So I don't know if I even can get close to answering that question, because it's not quite, that's not quite what I try to do. Maybe that's what I should do, but in a way I feel like very involved with this sort of reassessing of what we understand and how we can do things. And I mean, it did come up in various ways that there's a sort of for example, listen to the science, or listen to the scientists. And there's always such a bigger kind of chain reaction of, yes, of course we should, and everybody should, and the politicians definitely should. And that's often the problem, that the politicians don't put the regulations and the laws into place, even though everybody is sort of, well, not everybody at all, but people are aware that they should listen to the scientists, unless that's translating into regulations. It's not necessarily, well, it's a process. It's an evolution. But back to making work as an artist and that sort of culture, I think it is a really crucial role to sort of change our perception, but it's not necessarily our role to be so linear or specific. I think this is an ongoing conversation that I have about the Arctic or the deep sea, and because a lot of work is kind of touching on environmental questions, but not in a sort of way that tells people what to do. I think it is about understanding that we need to learn a lot of things, and that we don't know everything, and there's a lot of things that are invisible and so on. So I don't know if that answers the question, sorry.
We have a question from Jackie Jones, who asks, wouldn't it be better to educate the public on the causes of zoonotic diseases, which she defines as eating wild animals and the meat from wild animals, rather than throwing so much money at mitigating the effects when they occur. Is it as simple as that, David?
No, I don't think it's that simple. I think certainly that one way on from this is better economic development in those countries most at risk from creating the opportunity for zoonotic diseases to emerge. I think the most important thing really out of this discussion in terms of equity in climate change, COVID-19, zoonotic diseases, is that we are all under threat wherever this happens. So we may have people in the West who are saying, whatever happens in Africa doesn't impact on us. Whatever happens in China doesn't impact on us. You know, this is COVID-19. The virus has emerged from Wuhan in China, and the whole world is suffering because we haven't responded well. And when it comes to vaccines, we have been very selfish about vaccines, and even today, we're still not understanding that the emergence of a new form of this virus in India that has threatened us into a third wave, which is now taking off dramatically, is precisely because we didn't pursue this notion of vaccinating the world rather than just making sure that we could vaccinate ourselves. I think the other side of it, in addition to equity, I come back to this point, and I just add to a comment that was made before. We have treated ourselves not as a part of nature, but apart from nature. And that is where we've gone wrong, is this not realizing that we also co-evolved with all of the rest of the natural systems, not only the living systems, but the geological systems. And we need to really develop a full understanding of our relationship with the whole world, because this is what puts us at risk when climate change or COVID-19 comes along, and these are global problems. And so we are responsible for this. Now, just coming back to the question of equity, I've got to say that since 1945, every global agreement that has been achieved, including the development of the United Nations, was at the behest and leadership of the United States. And when it came to climate change, the climate change deniers were so successful that we have suffered from the lack of leadership from the United States, both in terms of their domestic policies, and this is where the complaint correctly comes from developing countries, pointing the finger at them, not cutting back on emissions, while they're demanding that the rest of the world cut back. So I do think we may be in a different place now. We seem to have a situation where China and the United States, working with the European Union, are seeking a solution to this problem. And that is the right way forward.
Again, I guess, I mean, we touched on the question of political decisions in this, and what we, whoever we are, want. I think, though, surely people have to give politicians permission to make these decisions, and not everybody, and perhaps there is a question in the messaging about climate change. And again, going back to Penny's account of the problematic outcomes of successful health programs, does action require sacrifice? How much change? How is change to be described? Is it, you know, is it sacrifice? Is it less affluence? Is it confounding the expectation that we will grow steadily richer? These are difficult messages for any political system, including, I have to say, the Chinese. Don't we have to initiate this rather than hoping that the politicians will lead? David, you've been in this business a long time. Very briefly.
I've got to say that without political leadership, without regulatory systems delivered by political leadership, we wouldn't manage this. Britain, and obviously, I feel some part I played in this was with Tony Blair. Britain has led the world on climate change.
Yeah.
And this tiny little country isn't good enough to lead the world. That's the problem. But we have...
I'm sorry to cut you off, but we are coming very close to
Yeah.
the end. And I'd like to hear from Malila about how whether art can really help us to reassess our place in nature and our relationship with nature. Very briefly, if you
No, very briefly. It's a big
Sorry,
job.
I know it's a huge existential question. Just very briefly.
I think it can certainly try, and sometimes it can. I don't think you can possibly generalize, but yeah, it's really important and very it's got a really important role to play to sort of help that process. And I totally agree. It's politicians have to make the rules and the change the laws and change the perception, but really there has to be a lot of pressure from elsewhere as well. So it's always going to be this rather complex process. So it's never a straight answer to that one, but yeah.
Penny, again, regrettably briefly, you're in this science, which is really at the forefront of changing our thinking. As we hopefully emerge from the worst of the pandemic, are you optimistic that we really will adjust the way we think and our approach to nature and to the relationship with health?
I think it's the $1 million question. I want to remain optimistic, and I think there are some solutions that have been talked about that are very promising. But I guess in conclusion, I sort of want to bring this idea of equity back, because and the role of politicians, because as we discuss on some of those solutions, we have to bear in mind the developmental needs for a lot of countries in the global south. And just to realize that in the West, we are where we are because we polluted a lot, we emitted a lot, and some of those countries want to get to where we are, rightfully so. So it's a bit of a balancing act, and lots of decisions to be taken at a global scale.
Thank you all very much indeed. And to our audience, I think if we have brief conclusions to our discussion, it's that we need more equity, more solidarity, and perhaps rather more humility about our place in nature, and under greater understanding that if we don't take care of nature, then we are damaging ourselves and our fellow human beings. Very gracefully argued by my wonderful panel, David, Penny and Marilla. Thank you all very much, and thank you for joining us. There is another discussion at the same time next week, which is going to be talking about how taking care of nature can help us thrive. So please tune into that. Thank you very much for Invisible Dust and Forecast for giving us this chance to explore these very important ideas. Thank you. Goodbye.